My name's Lisa, and today I'm speaking to Farida, who is our Regional Director from East Africa. Hi, Farida.
Hi, Lisa. Everything is quite virtual, but one of the opportunities is making us also think differently about how we engage with communities in virtual spaces, how we can encourage especially our behavior change conversation, which is quite the focus of what we're doing now in reducing the spread and working towards preventing new infections. We're looking at how we can also spread a lot of these messages through virtual spaces, but also digital spaces, looking at how we can work with communities who are a very young population, and that's something that we have going for us, especially in Kenya, where over 50% of the population is very young, very youthful, so would either have direct access to digital spaces or would be familiar with digital spaces. So some of our messaging we're pushing push messages through mobile phones. We're also looking at social platforms like Facebook to pass on our messaging on prevention, but also on what to do if people suspect they might be ill. So really being able to just support our communities as well with life-saving communication at the moment. We are really working on being able to simplify messaging on prevention, understand the context, be able to respond and work with communities, even at this point, to be able to understand concepts like social distancing in an area like a low-income area where space is really an issue. We also have a lot of shared facilities. So when we're looking at sanitation coverage, for example, which has always been a challenge, we're still looking at 4 to 5 households that would have an average of 5 to 6 people sharing the same facility. So a lot of our approach at the moment is still working with community health workers who are community members and have put themselves forward to help us, pass on messages, ensure that communities still have access to free water, which is very important, but also have access to soap, have access to cleaning materials, and of course that ourselves, we work with the community workers, especially the health volunteers. We are making sure that they also have the protective gear to be able to engage with the community. So it's a unique challenge. And in the long run, everything that we're doing in still working to increase water access, improve sanitation coverage, everything that we're doing with waste workers, in the long run will have a serious added value to the communities that we're working with.